Hi there, I'm Dr. Shauna Dingman, and today I want to talk to you about when to use heat versus when to use ice. This comes up all the time in practice. So I'm hoping that this video with a really sort of quick formula will help you to know when to use heat and when to use ice at home. So think about it this way. When you've done something acute, say you've sprained your ankle, one of the things you notice with a sprained ankle is there's swelling around there. Swelling means that inflammation and there's fluid that's accumulating in there. Whenever you have anything like that, you never want to add heat, because what heat does is it causes more blood and fluid to accumulate in the area. So it's going to increase the swelling, which will ultimately increase the pain. So whenever you have something that's just happened, it's acute, the first 48 to even 72 hours, icing works best for something like that. So any kind of strains, sprains, bruising, goose eggs, anything like that, that's always ice. The flip side to it is that we have a lot of patients who have arthritic type pain, chronic kind of stiffness, pain in their joints. That's when heat can be really nice. And I think it's important to also say that everybody's a little bit different. So when it comes to something like arthritic pain, sometimes people actually prefer ice. But I would say that kind of that idea of the sort of moist heat is really nice. It's really soothing. So here's a couple of other examples. Say you have a headache. If it's a throbbing kind of headache, what a lot of people prefer is ice, either sort of at the back of their neck or across their forehead, on their temples. You can even put some stones. You can get stones from the dollar store, keep them in the freezer or in the fridge so they're nice and cold, and just put them on your temples. That can be really, really soothing. But for people who get those chronic tension type of headaches, moist heat can actually really help to relieve the pain from the muscle tightness. Again, it's one of those things that you have to test those things out for yourself, but follow that principle of sort of something that's been hit, is throbbing, is swollen. You want to go with ice. Other things, you can try heat. Now, if you put heat on something and it feels worse after, just put some ice on. Typical time frame that I usually recommend for people is no more than 10 minutes of ice on an area at a time. And you always want to make sure that it's wrapped, the ice is wrapped in something so it's not directly on the skin. I like to tell people to wet down a tea towel, wrap your ice or your ice pack in the tea towel and put it on the area, but then take it off after 10 minutes. If you're going to do heat, same thing. You can just take one of those bean type sacks and heat it up in the microwave. Test the heat of it first though for more than 10 seconds. Sometimes when you heat things in the microwave, they get hotter after you take them out. And especially if you're putting it on a child, you want to make sure that you've really tested out the temperature. So I hope that helps. Leave some comments and let me know what works best for you under what circumstances. And if you have any questions about, hey, listen, if you have chronic strain in your low back, for example, or you're getting chronic headaches and you feel like you're always looking for an ice pack or some kind of a heating pad, get a chiropractic checkup. It's one of the things that chiropractic is fantastic for, and I would love to help you out with that. Have an awesome day. I hope this video helped.